Try again.
So we got people.
Oh, yeah, now you're loud.
All right. We'll give people time to join and then we'll
Okay.
start it.
Exactly. Let me just put the other one up.
All right.
Okay, all good.
All right, so we'll get started in a bit. Excited to see so many people joining. I guess this is a good sign given that we're all trapped at home and away from our peers. So as you can see, I am in the conference room alone, away from Dr. Hand because we're practicing social distancing.
We are.
One should. So we're in different rooms, but in the same building. So this session is about COVID-19. So we want to provide information about COVID-19 as well as answer any questions that you all may have about this pandemic. So today we will be speaking with 3 providers. First up, we have Dr. Hand, who you see here on screen, and then we'll follow that with Dr. Abbott, and then Dr. Pumphrey. So be sure to put your questions or comments in the chat, and I'll do my best to address them as we have this discussion. I see a bunch of my friends who I know are at home. Thank you all for joining. So hi, Dr. Hand. How are you?
Hi. I'm good. Hanging in there. How are you doing?
I'm good. I'm good. You know, I've been, this is the first time I've been out in 4 days, so it's really good to be away from, you know, the house. So let's get started. So what is COVID-19?
So COVID-19 is a coronavirus. Coronaviruses are well known. There are other coronaviruses that are respiratory viruses, and this is a new novel coronavirus that's been given the name SARS-CoV-2 is the official name of the virus, and the disease it causes is COVID. Kind of like when we talk about HIV and AIDS, which is something we're familiar and talk frequently about at Whitman-Walker. HIV is the name of the virus and AIDS is the name of the disease if you get sick from the virus. So it's a similar idea. The name of the virus is SARS-CoV-2 and the disease it causes is COVID.
Nice, nice. So how does it spread? You know, we've been watching the news and seeing all these cases, you know, sprouting up around the world. Like, what is the current, you know, information that we have about how the virus spreads?
So it spreads through respiratory droplets, but that is in 2 ways. So certainly if someone is sick and they directly cough on you and you breathe that in, you can be infected. But people can also be infected because someone has coughed or sneezed and it's landed in the environment around them. Or they coughed and sneezed and they take their hand and they wipe their nose and then they grab the door handle and you come after them and grab the door handle and then you touch your face. So I think we've all been practicing not touching our faces for the last couple of weeks, and that's really good. But that's the basic way how it spreads, which is why hand washing and cleaning surfaces has become so important.
Okay. So, and this is a sideline question. So I know there's been like information floating around that it can kind of linger from a person breathing. Is that valid, or should we be concerned there?
The virus can live in the environment, but it's very variable. So I think It depends on the temperature and the humidity and the conditions where the virus lands. So yes, can the virus live on surfaces, and is there a good reason to clean frequently touched surfaces such as door handles and light switches, your cell phone, those types of things? Absolutely. Exactly how long it lives, there's not a great definitive answer, but probably it can live for a couple days, and if it's in perfect conditions, longer, and if it's in not good conditions, for maybe just a couple hours.
Got it. So thanks for that. That clears it up for me. If there are any questions, feel free to jump in as well as we go through my questions. But so as we've all been watching the news about this virus, and we see that people are buying masks, thinking that they protect them. Do they actually protect you? Should I be wearing a mask right now?
Healthy people shouldn't be wearing masks. And, healthcare workers, providers, emergency personnel are in desperate need of supplies of masks. So, and it's really important that they have them when they're closely examining and caring for patients. So if you're healthy, wearing a mask is not helpful. Now, certainly if you're sick and you need to go seek medical attention, if you can cover your mouth and nose so that you prevent your germs from spreading if you cough or sneeze, that is helpful.
Thanks for that. And we have a question. So someone asked, what about in air? We have been seeing the news that it's airborne. Should I wear a mask? Should my partners wear a mask? Parent.
I think the virus doesn't stay in the air for a long time. So this isn't like measles. So measles is airborne and really is transmitted. People can be in a room and come in hours later and breathe that same air and be infected. This is not like that. This virus does not stay up in the air for prolonged periods of time. So that really isn't the major way it's spreading. Got it.
So, I know that, we're supposed to practice social distancing, but what are some other methods that, we could utilize to stay healthy and kind of avoid contact with this virus, if that makes sense?
So frequently washing your hands has to be number one. And the way in which you wash your hands is really important. It's not briefly running your hands under warm water with a little bit of soap. It is scrubbing your hands for 20 seconds underneath your fingernails, all in between your fingers for 20 seconds with soap and water, and then rinsing them off and drying them. So that is something that everyone should be doing frequently, multiple times a day. In between, if you can't wash your hands, you can certainly use hand sanitizer. It's good. It's not as good as washing your hands. Simple soap and water is the best thing to do. I think it's also good to just care for yourself and make sure that you're getting enough rest, that you're managing your stress, because those things are going to help you be more resilient through this time. Got it.
And so, I went to, Walmart right before things got really crazy. I noticed there was no hand sanitizer. Is it okay, me not having hand sanitizer to supplement that with just regular hand washing?
Yeah, regular hand washing is great. Hand washing is great. So you don't need hand sanitizer to keep your hands clean. You can wash your hands frequently, and that will work very well.
Got it. And so we have a question in the comments. B versus B asks if, this is pollen season, so how can we differentiate between, just symptoms from allergies versus actual coronavirus symptoms?
Yeah, no, that's a great question, because DC has terrible allergies. The DMV is notorious. I never had allergies before I moved to the DMV, and now I suffer with them every year. So allergies are different. So although allergies may cause a cough, generally they don't cause as much of a cough as they cause a stuffy, runny nose, perhaps a sore throat, and often itchy eyes, watery eyes. Often people with allergies may get a headache as well. Certainly with allergies, you're not going to have a fever, and that's one of the hallmarks of COVID. So whereas COVID is really fever and cough, persistent cough, allergies are going to be maybe a little cough, but a sore throat, a stuffy nose, watery itchy eyes.
Got it. Got it. We have a very interesting question in the comments here as well. Is it safe to have sex? Because many are abstaining from sex as a prevention method. Should we be concerned?
You know, I think it depends who you're engaging with. You know, if you have one partner or someone you're living with and close with, and you're together all the time, you know, you're in essence to some degree practicing social distancing because you're kind of your own island, right? So I think, you know, people don't need to stop having sex because of COVID, but certainly this isn't the time to go out and meet a lot of new people because obviously that can put you at high risk.
Got it. All right. Thanks for that. I think that was a great question. So, you know, what are some common symptoms? Like, I guess we already asked this, like, but, you know, what are common symptoms of COVID-19? Things that should definitely, you know, trigger us to be, you know, concerned that we may be infected or
yeah. So I think the first thing is a persistent cough followed off associated with a fever. So those are the hallmarks. And I think the majority of people who get COVID will have a fever, and the fever might be somewhat transient and the cough may be much more persistent, but at some point they may have a fever. So if you can monitor your temperature at home, if you have a thermometer, wonderful. But if not, just being aware of that. And then I think the other thing that is more common with people who get more severe illness is feeling a little short of breath. And that may manifest itself as simply kind of feeling like you can't quite catch your breath or you're more breathless than usual associated with a cough.
Got it. So we're getting a lot of questions in the comments, which is good. So let's address a few of those. So how many days should you have the symptoms before seeking a doctor?
So if you have 2 out of those 3 symptoms, if you have shortness of breath and a cough, or you have a fever and cough, if you have 2 of those 3 symptoms, I would say call your provider and seek medical advice. And depending on what they recommend, they may recommend that you come in for testing. They may recommend that your symptoms are consistent with COVID and they want you to self-quarantine and stay at home and just stay in touch with them about how you're doing. But that if you have 2 of those symptoms, I would reach out. Got it.
So we have a question. So we've heard a lot about, you know, younger people being, you know, being able to more so overcome the virus if they were to be infected. What are the vulnerable populations and how do we identify those populations?
Yeah, so I think there are 2 parts to that question. So one, when we talk about younger people being less vulnerable, I think we need to be clear what that means. So I think it doesn't mean that you're less likely to be infected. And it also doesn't mean that you won't get pretty sick. It means you're less likely to die, which is a great thing. That's very good. None of us want to die. But it doesn't mean that this can't knock you for a loop because you're younger. And so I think when you look at some of the data out of China and they say 80% get mild illness, what they meant by mild illness was that 80% of people didn't need to be hospitalized. They didn't need supplemental oxygen. It didn't mean they weren't really pretty sick and feeling somewhat short of breath and having a cough. So now other people may be almost asymptomatic. So there is a big spectrum of illness that we're still learning about with this epidemic. But I think that's really important for younger people to realize that when they say, oh, you aren't going to be as affected if you're younger, you're only going to get a very mild illness. It's not like you're going to have a cough for one day necessarily and feel better. So that's point 1. And then point 2, so who is at increased risk? I think we know people who are over 60 are at increased risk, and people with chronic medical problems. So people with diabetes, cardiovascular disease, underlying lung conditions, COPD, emphysema, people with high blood pressure. Those people seem to be at higher risk. And given the work we do, then the natural next question is, what about HIV and people who have HIV? So I think what we know about people who have HIV is people who are well controlled with their HIV and their immune system is pretty intact, probably don't have a lot greater risk than the general population, but the comorbid conditions and age still come into play. So we have to remember that half the people living with HIV in the city are over 50. And so a lot of them naturally fall into the higher risk category based on their age. And so it is HIV in and of itself may not make you at increased risk if you're well controlled with an excellent CD4 count, viral load is completely suppressed, but you have to look at other things. What other conditions do you have? How old are you?
Got it. So we have a question from a friend of mine, Joe. Joe's a personal trainer, and so he wants to know, is it okay to continue training his clients using, social distance, I guess like 6 feet apart, since all the gym are closed, or should he just stop altogether? What advice would you give him?
So I would consider, I don't know that you need to stop, but I would start to think of creative ways that you can train your clients. If you can train them in their homes over FaceTime, I would really encourage that. I haven't done that with a trainer yet, but I know like my daughter has musical lessons. She had a guitar lesson via, FaceTime yesterday. So I think that is probably good. It's not so much that you wouldn't be 6 feet apart during the lesson, but the travel, getting to place and the people you come in contact with when you're going out, that puts you at risk, and the more things you're touching and doing. So.
Got it. That's good. Yeah. And another good question. So for people with asthma, what can they do to separate, normal shortness of breath versus COVID-19 symptoms?
Yeah, that can be hard. And so a lot of it is fever, and a lot of it is if the cough is somehow different from the cough you get with asthma. I think for people who have asthma right now, it's really important to get on top of your asthma. So if you use a preventive inhaler every day to prevent exacerbations, be on that. Make sure you're doing that so that you're not requiring a rescue inhaler. So if something changes, you'll know to pay attention to it. And then if you can't discern that, call your doctor and talk through it and be evaluated.
All right. And last question here we have is there a test for COVID-19, and is it available?
So there is testing. I think everyone has heard that testing has been very limited and slow to scale up in DC, and that certainly has been our experience at Whitman-Walker as well. I think a lot of places in the city now have testing through LabCorp, and I believe Quest has come online as well. We're using LabCorp. The turnaround time for testing has been slow. It's been as much as 7 days. Today we got back some tests in 5 days. So testing is still a challenge, and making sure we have all the supplies to run the tests is still a challenge. But we are testing, and we hope that we'll continue to be able to scale that.
Gotcha. And so I have a question. So what, me being an employee here at Whitman-Walker, sometimes I'm a little out of the loop, but I want to know exactly what are we doing in response to COVID-19?
So it's been a great learning experience for us over the last 2 weeks, and it's been incredible to see all our employees respond and pitch in and want to help. So we are working really hard from our media presence and working to inform community like we're doing tonight, to making sure that we're also serving patients. So we've stood up respiratory clinics this week at both our sites where we are evaluating people with symptoms. We have expanded our triage hours so that you can talk to either a nurse or provider during all the hours that we are open, so that we can assess you. And next week we're going to be rolling out telehealth visits for all our regular medical visits, for chronic disease management, for PEP, for engagement in HIV care if you're newly diagnosed, and all the other services we do. So we're really working to make sure that people have their medications, that they get the treatment that they need. while rapidly changing our services to also address this pandemic.
Great. So I want to thank you, Dr. Ham, for joining. I know that we have 2 more providers to fit in. And so we'll address the next questions with the provider, but stay healthy.
Thank you. You too.
Great seeing you.
To good health for all. All right.
Yes.
All right. Take care.
All right. So next up, we'll be joined with Dr. Abbott, who's going to give us a little bit more information specifically about, if you think you've, been in contact with COVID-19, what those symptoms may be, and a little more of that specificity. So thank you, Dr. Abbott, for joining.
No problem. Thank you for signing on, everybody.
Yeah. And so,
Actually, he's going to introduce himself first.
yeah, so go for it. If you want to go and introduce yourself.
Sure. So I'm an infectious disease physician, Dr. Stephen Abbott. I've been in DC for over 10 years. For the majority of that time, I've been practicing HIV medicine. I started off at another clinic, and I've been at Whitman-Walker for 3 years, but Whitman-Walker is not unfamiliar to me. I came to Whitman-Walker when I was 23 years old, newly out, concerned about this infection that was killing gay men, and I didn't know what to do. I had an HIV testing and education visit with community health at that time here at Whitman-Walker. And I must say, when I walked away from that encounter, I got informed. I knew how to change my behavior to stay healthy, and I knew that there was a place I could go to get care. And I'm feeling a lot of similarities to what went on for many of us in the 80s and 90s to what I hear people going through now. There's a lot of anxiety because we have limited access to testing. We have a lack of federal leadership. We have no treatment, and people are dying. So I want everyone out there to know Whitman-Walker has been here before. It's similar. It's a different time, and a different place, and a different disease. But we will take care of the community. So don't be afraid to call. Don't be afraid to text. Don't be afraid to reach out.
Thanks for that message, Dr. Abbott.
No problem.
Great. And so, I mean, that was really enlightening. So to get into, the questions around COVID-19, people are concerned, and, because there's a lack of information, there's stories floating around with misinformation. And so to be able to get, information directly from providers with experience and has the knowledge is really, rare. So I'm glad
there's a lot of really useful information at our website with links to reliable sources that have been vetted. Always check the references for any site that you go to. There's a lot of useful information actually at the CDC website and the World Health Organization website that is on a level that most people should be able to understand. And then I got to say the Department of Health at DC has a coronavirus toolkit on their website that has a lot of links to resources throughout the community. And they have a lot of information in multiple languages. So those are reliable sources that have been vetted by scientists and experts. It's based in fact, not fiction.
Got it. Great. So one of the major questions is, what do I do if I develop symptoms? And I think I have COVID-19. What should I do?
So I actually would recommend that you do a dry run. Pretend like you're sick tomorrow and go through some of the steps that we're about to talk about. First and foremost, you need to call your provider. If you're a patient at Whitman-Walker, you can call 202-745-7000 and either be connected to your provider directly, you'll get or a triage nurse, and eventually get through to your provider via message. A lot of clinics, including our own clinic, are set up for portal messages. Portal is a secure interface with your electronic medical record that you can use to contact your provider. So if phones start getting overrun and you're having trouble getting through, you should look into setting up a portal account so that you can send your provider a portal message. If you don't come to Whitman-Walker, there are many private practice offices out there that have portals, but you do need to sign up ahead of time. It's not the type of thing you want to do when you're sick and getting frustrated trying to call your provider. So first of all, figure out what you would get in touch with your provider if and when you get sick.
Great.
And call first, because we are doing a lot of things over the phone now. We're actually trying to help people stay at home and recover at home as opposed to coming into the clinic, potentially exposing other people. And we really want to save ER visits for folks who are in respiratory distress. So call first, look up the phone number now, see if you have portal access.
A little bit. So, I think you said something that's very important. If I think I have COVID-19, the first step would be to call my provider, describe my symptoms before running to the ER, correct?
Correct.
Right, because we don't want to.
Go ahead.
No, I was saying because we don't want to infect others. So when should we actually go to the ER? Like, how do we know it's time to actually go to the ER?
If you're having difficulty breathing or wheezing, you can't get your breath, you get up to change the channel. Well, you get up to go to the bathroom, you get up to get something out of the refrigerator, and you are weak and fatigued and short of breath, you need to call 911.
Yeah. And so I think that goes in line with the question we were just asked. What are the signs and symptoms of respiratory distress? So wheezing, you named a few more.
If you're working harder to get air into your lungs or get air out of your lungs, if you're not able to do the simplest functions like get up out of bed and go to the bathroom, or if you notice that your lips are trying to turn a little blue, then you need to call 911.
Gotcha. All right. And let's say I do have a cough. Like, how do I manage that at home?
So we don't want to completely suppress the cough. Cough is actually your body's natural way of fighting off a lung infection. You want the cough helps remove mucus and open up your airways so your lungs are still able to function somewhat normally while you have the infection. So we want you to cough a little bit, but we also want you to be able to get some rest. So you can try home remedies like tea with honey. Honey is really good at helping calm down a cough. Humidifiers are great because that can help calm the cough. Cough drops, lemon drops, hard candy, and good old Vicks Stab. Can't go wrong with Vicks.
And ginger ale. All right, thanks for those tips. So if I've had prolonged contact with someone diagnosed with COVID-19, or I've been to a country that has been identified by the CDC as a high risk, country, but I don't have symptoms, what should I do?
So if you're returning from a high risk country, you need to self-isolate for 14 days. All right. And if you've come in contact with someone, I would suggest you call your provider to sort out those details. That can get a little more into gray areas depending on the type of contact, how long you've had the contact. Is the person actually a confirmed case? Are their symptoms really consistent with COVID? You really need to, in terms of symptoms, you need to look out for the cough that Dr. Hen was talking about, as well as fever. Fever is a key component of your symptoms when you have COVID. So along with getting prepared ahead of time for when you get sick, everybody should check their medicine cabinet and make sure that they have a thermometer that works. I mean, I'm embarrassed to admit until last week I didn't have a thermometer. But that should be part of your COVID kit. Doctor's phone number, cough medication, and a thermometer.
Got it. Yeah, I actually just got a new one, so I'm good there. Cool digital one too that actually gives you your range where you should be based on standards. So
I see somebody's asking what is a fever with COVID. I would say anything over 100, pick up the phone and call your provider.
Got it. And so on that, should I take ibuprofen if I have a fever?
So there is some emerging data out of China that ibuprofen was not the best antipyretic for COVID. It's not clear. There are some experts who are saying that we should stop recommending ibuprofen, and since we do have an alternative, Tylenol, I'm telling my patients to take Tylenol instead.
All right, so take Tylenol instead of ibuprofen. Good point. All right, and so I have we missed a question a few back. So someone asked, if their mother has lupus and is extremely concerned about coming in contact with COVID-19. Do you have any advice that could help alleviate some of her concern?
Her mother should definitely have a conversation with her provider, because there are medicines that folks with lupus that are prescribed that are going to put her at increased risk for COVID. So it's possible she falls into the group that is categorized as high risk for severe disease and needs to really start cutting back further and further on her social interactions while the virus is spreading in DC. But first and foremost, you need to call your provider. We are preparing for these questions. We are hoping that you call. So yes, her mother should be concerned and should call her provider. If she's immunosuppressed from her lupus medications, she needs to cut back to basically isolation at home.
Got it. All right. Thanks for that information. So one question that we got is, will warm weather or hot weather stop COVID-19?
No.
All right. Well, thanks for that answer.
Sorry.
Is there anything else you can add to that?
So I'm blanking on my reference at this moment, but it was an article at the WHO yesterday that got published online that said preliminary data shows that in countries where there's warmer weather, they are still going to experience the same pandemic the rest of us are experiencing. It's great that we're moving into spring, and the theory has always been with influenza that when the weather warms up and people are outside, you're in less crowded conditions, you're opening up the windows, ventilation improves, and that may be why we see a dip in flu when the weather breaks. We don't know if that's going to happen with COVID. I mean, I hope it does. I hope I'm wrong. But proceed as if it is going to be here for a while, even if it gets up to 85 degrees.
Got it.
It's here, and we've got to prepare, and don't assume it's going to go away when the weather breaks.
Got it. Another question. So is it possible to have COVID but not have, some of the symptoms such as fever?
Yes. Not everybody is going to have a severe infection. We don't know how many people are just going to pass by with an asymptomatic infection, but most people, if you have a fever at this point in DC, there's a strong possibility that you're infected with COVID and you should call your provider. Not everybody with COVID will have a fever, but the majority of people will.
So I actually think you just answered two of the questions there. So someone just asked, should I call my provider first before going to the clinic? And
Yes. We need to know you're coming because we have systems in place to prevent exposing other people to COVID if you are coughing. We don't want you coughing on the woman with lupus if she happens to have an appointment. And we need to know that you need specific isolation. We don't want you sitting in the waiting room. We want to be able to move you back to an exam room as quickly as possible. So, and if it happens that, we're overwhelmed, we may ask you to come in at a specific time. So please call first.
Got it. All right. And so a question we have here is one immune after they contract COVID? So
we hope so. Again, this is a new virus and there's a lot that we don't know. And China will give us the answer to that question in the next couple months.
Got it. All right. So if I am in that high risk population, how long should I anticipate being isolated? So
I'm going to go with what Dr. Fauci said a couple weeks ago, and we should expect to be hunkering down for the next 8 weeks.
Okay.
And that will probably be revised in 6 weeks. But plan for a 2-month period.
Okay. I know a lot of people probably aren't excited to hear that, but
sorry.
That's the information. So it's unfortunate, but that's what it is.
But stay tuned. Things are changing rapidly. Something might break in the next 2 weeks, and hopefully we'll be able to modify some of our recommendations. But as it is right now, if it continues to spread at the rate that it's spreading, you need to be practicing isolation for 8 weeks.
Yeah. Great. So we got a question, a few comments back. We know that, Whitman-Walker is very big on volunteering and accepting volunteers. Is there any way right now that people can volunteer to help Whitman-Walker, or should we just encourage, the social distancing? We're managing it, here as we can.
That is an excellent question, and I'm wondering if maybe there's something that people can do remotely that would help. I don't know if we have anything in place right now, but at our website, there's a link to volunteering, and I'll be sure to follow up and see if they've thought about ways that maybe volunteers can call and check on people who are feeling alone and just need a friendly voice to talk to.
They can call me or hit me up on Instagram.
Well, not all of us are Instagram savvy. I still don't know how to get to this page.
Okay, though, I believe we have some resources coming in the comments. So for those of you who asked that question, just stand by and we'll get that in the comments for you.
Somebody's asking if we have a need for donations, and I'm going to say emphatically yes.
Yes, got it. There's always a need for donations.
Right. Say no to money.
All right, Dr. Abbott, is there anything else you want to share with the group before, we let you go back to your social distancing?
So we're social distancing, but that doesn't mean you should drop out of touch with people. I mean, I think, I referred back to what it was like in the 80s as a gay man. One of the things that I learned then is that we've got to take care of each other. You've got to reach out and touch someone every now and then. We're all going to feel a little anxious, a little isolated. I've started several group chats just so that people are in touch with each other. We can get through this, but it's going to take a lot of empathy and a lot of conscious connections, I should say. It's going to get hard, and we're going to need support. So don't be afraid to reach out to someone, even if you haven't talked to them in a while.
Great. Thanks for that advice. All right. So thank you again.
Mm-hmm.
We really appreciate all the information.
Well, thank you for the invitation.
Yeah, of course. So next up, we are going to be meeting with Dr. Pumphrey. And he'll give us his take on, how we can stay, connected during this very difficult time of this social isolation. A lot of us are, self-contained, and we're unable to, be with our peers, and that can take a toll on us, mentally. So here we have Dr. Pumphrey.
Hi there.
I'll let you introduce yourself and how what you do here at Whitman-Walker, and yeah, go for it.
Sure. My name is Dr. Randy Pumphrey. I'm the Senior Director of Behavioral Health. And that's a big title meaning I take care of the Behavioral Health Department, which includes psychiatry, mental health, psychotherapy, groups, peer counseling, and addiction care.
Great. Well, thanks.
You're welcome.
From joining, I don't know if you can answer this question, Dr. Pumphrey, but we just got one that came in that
Sure.
asked if can COVID spread through food?
So that's a medical question that I think we probably would have to go back to one of our medical providers. I think that the answer that I would guess is because it can be communicated through droplets. So if you have food, like if you live in the 14th Street or around the 14th Street district, that Whole Foods just shut down their banquet. They're out serving food because I think for that even though you have glass screens, people could cough or something and then it could contaminate the food. So I think that's the big risk.
Gotcha. All right. Thanks for that.
Sure.
So back to the behavioral question.
Sure. Thanks. That's my wheelhouse. So you might want to stay there for me.
Yeah. So, this is a particularly stressful time, obviously, with everyone being isolated. What are some of the tips that you could give us, to stay, healthy mentally?
Sure. So, one of the things that everyone is talking about is this idea of social distancing. And social distancing, although it's a nice health strategy, it actually is oppositional to mental health. So if a person is struggling with mental health issues like depression, even anxiety, or a person is struggling with substance use disorders, many people actually say that substance use disorders at its heart is a disease of social isolation. And so when you're telling people to distance, it goes directly against kind of the fundamental thing we say to people who are dealing with mental health issues, substance abuse issues. And so it's like, how do you do social distancing but still remain connected? And that's the big struggle. So you have to figure out how to do that. And there's ways to do it. And one of the things I would say to my clients is that human beings really are group-oriented or herd-oriented. We need to be around other people. So find a way to do that. And that's challenging. Many of my clients who are substance users and substance users who are in recovery, the one thing they always say in recovery is recovery doesn't have an I in it. Addiction does. And I meaning being alone, just by myself. And so how do you continue to sustain connection to other people when things like AA meetings have stopped meeting on a regular basis, churches have stopped meeting on a regular basis? All these social functions that support sobriety or recovery or just give people a sense of meaning have stopped. You have to find other ways. So, I go find friends, connect, talk, text, have conversation, try to see people if it's like FaceTime, like actually have a conversation, or go for a walk and keep social distance, but get outside. Like today's a beautiful day. And I think today was the first day I actually saw people walking around more. And that made me happy because I thought these people are finally realizing they can do that.
Yeah, no, and yeah, same here. I went for, a jog yesterday. I plan to do one tonight as well. In my neighborhood, I've seen everyone spending time with their pets and
Right.
So those things we can still do. I definitely encourage everyone to continue that. But for those of us, who have loved ones who are, maybe feeling particularly anxious or concerned, depressed, or maybe even struggle with, OCD, like how can they manage during this time?
Sure. I think that was a really good question, the question around OCD, and I gave it some more thought after thinking about my answer earlier. And I know that for myself, for instance, my husband and I, my 91-year-old mom lives with us. And so here I have a very elderly person who's in good health, who's there, but also have a friend who's staying with us who has a lot of other health issues. And, I know that she has been really, really trying hard to keep up. And that's what happens. People can get obsessed with, how am I cleaning? How many times do I have to bleach wipe the doorknobs or things? And I keep reminding her, first, lean into the relationship, remind people that, okay, this is enough, support them or help them. And communication is usually the best thing because most people who lean toward being OCD tend to also lean toward being very anxious. And the OCD or doing that function is a way that they've learned to sort of relieve the anxiety. But social connection can help you relieve anxiety, like get your brain out of the place where you're anxious and into the place where you're thinking again and relating. So, one of the things I always think is talk, share, get off the subject of coronavirus, get into the subject of something else, which is another point that I think is really important to the clients I work with. Is I say you have to take an appropriate dose of news. People will be on a constant drip all day of like reading and reading and reading, and they just keep themselves in a trauma state instead of saying, you know what, I got enough. I got my 20 minutes. It's nothing big has changed yet. If I'm not a healthcare provider, and let me go on and live my life.
Yeah, great advice. Yeah, so for those, who, are spending more time at home, which is all of us, should be all of us, I should say. What are some suggestions for fostering a healthy living environment?
Okay, so first, I heard Dr. Henn say this, and it's really important. Be really mindful of things like eating well, sleeping, rest, getting exercise. Also, finding ways to play that are safe for you and those in your cohort. Another thing is practicing meditation. for people who are like mindfully based, that can really calm down their system, so they're less likely to get sick. They're going to create more of the positive things that they need in their body just to keep themselves healthy. One of my clients last night said, he said, well, now I'm spending all this time at home. I have started going on YouTube to learn how to do things. He said, so I changed a faucet and I put in a fan, and everybody was like, that's a great idea. And one person said, yeah, I did the same thing. I'm learning how to cook. And I thought, another great idea. So, and then one thing that even if you're in social isolation, because even in DC, I realized a lot of people live alone. And so making sure that you have a connection with somebody. So a couple of people can do a gratitude list, and every day they try to focus on 3 things that they're thankful for or grateful for. And Dr. Abbott was sharing with me just before he came in that he and a group of his friends are taking like inspirational pictures of something they're seeing, like flowers or something beautiful that they love, and they're sending it to each other all through the day, just to say, as a text. They don't put any words. It's just a pic of something that they think is beautiful. And I thought that was a really wonderful idea.
Yeah, that is a good idea. I like it. I do want to jump over to some questions we had on Facebook really quick. So one of the users asked, the answer to that is yes. If you feel healthy, you aren't symptoms, then it's okay to donate blood. And also, this is back over to you, Dr. Pumphrey. If we're spending more, like, how can we handle that? Like, should we stay away? Is it okay to be around each other? What do you think the recommendation would be for like the roommate housemate situation?
So you're breaking up a lot, and I'm not sure I even heard that question. It was something, so you might want to try it one more time.
All right, so sorry about that.
No, that's okay. I was like trying to decipher it, but I was like, I don't know.
Recommendations for roommates and housemates, what advice do you have for that particular situation?
Okay, so this is a huge issue and not one that anybody thought about really, because folks may be roommates, but they're both working and they're in and out of the house at different times, and maybe they have alternative schedules. And so they're not, when they're around each other, it's kind of a fun time, or they know they've worked it out. But now everybody has been sent home. And so now you have people who are in the house together and they're working. And so they're getting on each other's nerves. They're in each other's spaces. They're doing work phone calls. They don't have an office because they share like a small apartment in the city. And so people are really exploding. I mean, their really close, intimate relationships are starting to have a lot of stress and tension. So one of the things, they come back to the basics, and that is you have to lean in and not lead out. What we can do when we lean out is just make up the story and become resentful of the other person, and then we start blaming and shaming them. And what I suggest is you try to lean in by saying, we need to talk about the space and how we work here together. And so what you can do and what you can't do. And maybe you have to have work time and non-work time so the other person can get out and you can have some private time to do calls. It's just about communication and setting boundaries. But that sounds really easy, and it's often emotionally charged. So again, communication is the key. Boundaries are the key, and leaning in and not out is the key.
So similar question, is this the same for family? Are those practices, are there different practices versus, living with family versus your roommates and housemates?
So I think there's a lot of similarity, because oftentimes in families, there might be somebody, like whether these are LGBTQ families or hetero families, kind of oriented families, the thing that I realize is that person's schedules have changed. And so suddenly you have a person who's normally not working from home, who now is working from home. And that stress is really difficult. I was watching a webinar today that was about COVID-19, and about FQHCs and how we manage it. And the guy who was doing the webinar said at one point, he goes, of course, everyone, I'm at home and my daughter's here. And so I just have to attend to her for a moment. And suddenly he saw this little girl like pop up and he talked to her for a moment. And then she went back to watching her movie. And I thought to myself, all right, he just normalized what everybody's doing right now, that people are trying to manage, like being compassionate to the people around them, but also doing their job. And this is new, and it's not something that most of us are used to doing.
Good. And so I thank you for that comment or that answer there. So, you know, at Whitman-Walker, we obviously offer a lot of resources. One of those are behavioral health. You know, if I am a behavioral health patient, you know, what should I expect going forward for my appointments?
Sure. So as of today was the last day that we are seeing patients face-to-face, or clients as we call them in behavioral health. Starting tomorrow, everything will be moving to telehealth. That is psychiatry visits, and that's individual and group therapy. Our peer counseling, which is mostly group, has already gone to more conference calling, but we are using an app through our electronic medical record called Helo. So if you're a client and you haven't accessed Helo, you should go on our webpage and look for the directions. They put them really clear so that you can access the portal, and you can access the whole Helo app. And through that app, we'll do telehealth, meaning we'll do actually therapy sessions that are virtual. But be face-to-face, kind of like you and I talking. That you'll see me, I'll see you, and we'll share. Same thing will happen with psychiatry. So we're going to begin with individual therapy and individual substance use disorder treatment and psychiatry visits. And by next week, we should have the platform up for group therapies, and we're letting all the clients in, keeping in touch with them. We're also doing some other things that are really unique, like with where there are clients who are in recovery for substance use disorder issues. What we're trying to do is create times when they can just touch base with us and we can connect with them. So we're trying to, once we get the group up, we're thinking of having just some drop-in times when folks can check in for half an hour and all talk together and get support. So that's what you can expect. So if you haven't heard, your provider should be reaching out to you if you're already in behavioral health to make sure that you understand how to use the video telehealth app or platform. And then hopefully through next week, we'll all be learning together. And after that, we should be good to go.
Great. So yeah, the telehealth is definitely going to be, a new experience for some patients. And so this routine may be different. So if I am a patient, that has a mental health disorder, like how do I manage that without being, in my normal therapy routine?
So I think it is going to be disruptive, and part of it is, some folks don't either have the technology to be able to do it effectively. So that's going to be a next thing to work around. Sometimes they don't have the privacy. So let's say I need to do therapy and I have a roommate. Where do I go to do that? So there's some things that people can do, like if you have a private space and you're doing telehealth, making sure you use earphones or earbuds or something so that the other person isn't hearing the conversation that's saying to you, and it's only what you're saying, and try to put some sort of noise screen outside the door so that someone can't eavesdrop. It may be also that you go someplace, especially if the weather is nice and you can get someplace where it's nice outside, that can be a good place to do therapy. It's like when my early days of therapy at St. Elizabeth's, I used to take clients for walks and we would sit on a bench. So you could sit on a bench and do therapy. Just make sure there's nobody close by. Or if there's something really difficult that you're going through, make sure you have the privacy that you can feel safe, because that's going to be the biggest thing.
All right. My screen just froze.
That's my screen freeze.
Yeah. All right. I'm back.
You froze. I was like,
I was a little frozen there. Okay. So I lost my train of thought, but I think my question was, I have experience, being a patient myself at Whitman-Walker using, the Helo app. And, what if I require prescriptions? Are those things still going to be available? Can I, get them shipped to my home since we're doing the social distancing thing?
Sure. So I don't know whether, because I wasn't listening to what Dr. Han or Dr. Abbott said, but our pharmacy will deliver prescriptions, and so that's available to you. As far as our psychotropic medications and behavioral health by our psychiatrists, our psychiatric medical assistant has been actively getting people their prescriptions and medications, and even if we have to delay your appointment, we're going to be proactive to make sure that you get your refills. And one of the really wonderful things, I think, is that insurance companies, and especially like Medicaid, has really expedited many pre-authorizations so it doesn't hold up medications. That said, there will always be glitches, and please just talk to us so we can help you through it.
All right.
Wait for a second. We're also almost about done.
All right. I'm trying to get back to you.
Okay, good. I know I keep
Right.
losing you. I go, wait.
I think it's when we're both attempting to talk, maybe it creates a lag there.
Okay.
Yeah, I think that was pretty much it. Is there anything you want to add before we let you go?
Actually, oh no, I didn't bring my phone. Never mind. No, I was going to read it to you, which is really nice. What I want to say is to everybody, I think that this time, Dr. Abbott and I were talking about this before, and I know for myself, there's something about this time in our world that feels a lot like my experience of the early days of HIV, when there was just rumor that there was something out there and that thing could maybe kill you or impact your life seriously. And it wasn't until my friends started dying in mass that I realized what the potential of this thing was. And I think there's this really eerie feeling right now, especially living in Washington, D.C. and listening to what's happening in other parts of the world. Like, how will this impact my life? And will I know somebody who will die from this, or will I die from this? And that fear, that anxiety is real, and we have to deal with it. And the one thing I know is you don't deal with it well if you just lean away and try to run away. Is actually build community, connect with each other, love, and realize that we're going to get through this, and we're going to learn something. It may force us to face our shadows. It may force us to face parts of ourselves that we're scared of, but that will only make us stronger if we do it. And so I wish you all to be safe and to find love and to be happy.
Great. And one last question in the
Sure.
chat before we take off. And I froze again.
And the audio's still fine.
So what does someone whose triggers are the, isolation, what would that type of person do during this time?
So this is a huge thing for most people who suffer with depression, but particularly for folks who suffer with any kind of substance use issue. What I said before, everything that we tell a person with depression, or we tell somebody who's recovering from trying to stay abstinent or sober from substances, is to stay connected, go to meetings, have a herd that you stay connected with, communicate. Social isolation is a huge trigger. Last night, we conducted our final group of an OP program for substance users, and who are really struggling to embrace and maintain their recovery. And I sat with this beautiful, wonderful group of people who were scared that all the work they did.
That's terrible.
And I sat with this beautiful, wonderful.
It's not working.
No,
Facebook. I know Facebook is.
yeah.
Oh, here we go.
All right, so I've lost. All right, so we lost you at the end. My apologies there. I don't know what happened with the connection. But you were saying to wrap this up, yeah.
I was saying, as difficult as it may seem that we're going to get through this at this moment, we will. And there's a part of this experience that's so different. It's going to force us to look at ourselves in a different way. And it's going to ask us questions about our community, and it may forge new friendships and new ways of connection. Some people say, when will we get back to our old life? And what I say is, you don't know what your new life looks like yet. And this might be the opportunity to birth a new life. So good luck.
Thank you.
You're welcome.
All right. Dr. Pumphrey, thank you for joining us. I appreciate it. Continue practicing your social distancing.
Thanks.
And I'll let you go.
All right. Bye-bye. Have a nice evening.
All right. You too. So just to close out, I want to let you all know a little information. So our health centers at 1525 14th Street and our other health center at Max Robinson Center, which is located in Anacostia, will both be closed tomorrow. Our team is preparing our operations to actually deal with the situation at hand. So currently we will be planning to operate reduced hours for the health centers and pharmacies starting next week, Monday, March 23rd. So the plan is to move all appointments to telehealth through May 29th. So from March 23rd through May 29th, all appointments are moving to telehealth. And to all Whitman-Walker health patients, we will be having a respiratory clinic. That clinic functions by appointments only. So if you are experiencing symptoms, call your provider, and you could possibly get an appointment if they deem that it's necessary. So these will only be in-person appointments, and they will be happening through Friday, May 29th. So if you are a patient and you have urgent medical needs, or you think you're experiencing heavy symptoms from COVID-19, please give us a call at 202-745-7000. Again, that number is 202-745-7000. You can also visit us at whitmanwalker.org/COVID service updates for all the latest information that we have during this COVID-19 crisis. I appreciate all of your time today. And I just want to emphasize that it's extremely important to continue practicing social distancing. It is one of the ways that we can reduce the transmission of COVID-19. So we have to deliberately, limit or increase the physical space between the people that we love and care about. I know it's difficult, but it's important that we at least stay, 6 feet away, be able to avoid large crowds. That includes health spas, the movies, bars, restaurants, massage parlors, all the fun stuff that we typically do. Right now, we in DC are saying that these things are going to be limited access until April 1st. One other thing, and I know my jobs as well as Whitman-Walker has been encouraging this, work from home if that is possible in your career. Be sure to, not expose others by limiting, your face-to-face interactions and increasing your virtual interactions. So increase, communication with your loved ones over FaceTime, text. If you have any large gatherings planned, please, cancel those, especially if they're over 10 people. I think that's it for today. This is a very interesting time. I think it's a new experience for all of us. We are learning everything. Things are being updated constantly. So, again, stay tuned. You can also visit whitmanwalker.org/distancing care if you need some tips and tricks on how to manage during this time. So thanks for joining our live.